Hospitals across the U.S. are overwhelmed as the flu and other seasonal viruses have appeared earlier than usual this year. California is one of the hardest hit states. ABC News medical contributor and physician at Stanford Children's Health, Dr. Lok Patel, joins me live now for more on this. Dr. Patel, if this is where we are already, what happens as the holidays and colder weather come?
Simply put, Diane, we don't know, but we have to prepare for the fact that things could potentially get worse. We are seeing RSV and influenza not only earlier than usually, but faster. And there is a higher spike according to what we have in terms of data and CDC's flu view. So as the weather gets colder and we potentially start to see influenza move from the hardest hitting states right now, especially in the southeastern part of the country, to other parts as well, we just have to be on guard. Parents need to know what to look out for. And everyone out there needs to get their bivalent COVID vaccine if they haven't already and their flu shot.
Now, hospitals around the country were already reporting pediatric bed shortages due to RSV. Is there any sign of that calming down? And what can parents do in the meantime?
Potentially in some parts of the country, we are seeing a little bit of a plateau, but it is way too early to say that we know where the end of the tunnel really is. Because as you just mentioned, pediatric ICUs and emergency departments, outpatient clinics are all completely overrun right now. And Diane, this is on top of an already strained healthcare system. Pediatric ICUs are nearly full every single cold and flu season, and we have a severe healthcare worker shortage. So with that being said, parents out there need to just take a quick breath and realize that a lot of the care when it comes to a common cold, whether it's from RSV or another virus, is supportive care at home. So you can do very simple things like using a humidifier, helping your children clear that mucus, I know, gross term, with those suctioning devices, things like that, making sure your kids are taking good hydration, sleeping well. And one very important note, a plea from all healthcare workers across the country: if it is not an emergency, please do not take your child to the emergency department. You want to take your child to an emergency department if there is clearly a sign of respiratory distress. If your child is really having trouble moving air, breathing quickly, your child seems like he or her is drowning or gagging on their mucus. If it sounds that extreme, go to the ER. Otherwise, check in with a healthcare provider, check in with an urgent care or an outpatient clinic.
So when's the latest you think people can get their flu and COVID boosters to try to see that protection in time for the holidays?
For optimal protection, we want to get the shot and then wait 2 weeks after. But Diane, even if you were a little late right now, I would not hesitate. I would get those vaccines, the flu shot, your bivalent COVID shot. Make sure you're up to date in time for the holidays. And good news, the flu shot, which is catered every single year, does match the flu strain type A, which is dominant right now.
All right, Dr. Patel, we appreciate it as always. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.